Hello, I'm Judy Kutumash, President and CEO of Kutumash & Associates. And I have Jill Ryan, our Chief Administrative Officer, with me today. We'd like to talk about accountability in healthcare. We know that organizations struggle with accountability, how to hold people accountable. If we hold people accountable, are they going to be less willing to report their concerns, unsafe events, things like that? If we don't hold people accountable, are we creating an unsafe situation? I've asked Jill to give us some tips on how we can use accountability in organizations. Jill?
Sure, Judy, thanks. One of the things that we see in organizations as a challenge is consistently holding people accountable across the organization, by discipline, by department. And so some tips that we've seen work well in many healthcare organizations are creating an infrastructure of policies and procedures and mechanisms that are consistently applied across the organization, educating all staff, all disciplines, from the medical staff to housekeeping to nursing, on what that structure is and what those policies and procedures are, and then consistently applying them when issues do arise. We see that structure work best.
Thank you, Jill. Jill's tips are really important for us to take away. It is important to have a structure. It's important to define what we mean by accountability and to help those in our organizations to know what that means to them. Jill?
Sure, and just in closing, what we see is a solid accountability structure consistently applied, creating a patient-safe environment and really getting us to our universal goal of zero patient harm.
Thank you for joining us today. At Kutumash & Associates, accountability in healthcare is a very important topic. We're glad that we had the opportunity to speak with you today, and we look forward to seeing what organizations are doing with accountability in the future.